Hey guys, welcome to our I think we're on day 12 now or 13 of our 21 day challenge. So we are more than halfway there. I have an awesome special guest today, Dr. Rachelle Nguyen, who is my physical therapist. And I've been seeing her, I think, for the last 2 years now, on and off. But Rachelle, do you want to introduce yourself and talk a little bit about what you do in physical therapy?
Yeah, hi guys. My name is Rochelle. I work at Spear Physical Therapy in New York City. And yeah, Jesse and I have been seeing each other for various things, and it's been really great to get to know her because obviously she's a great patient.
It's bittersweet, I say every time, because I come
That's what I say. I love seeing you, but I hate that you're here because that means that there's something that is bothering you,
also not.
We get through it every time.
I also keep telling people like I'm obsessed with physical therapy now, and every time something hurts, I'm like, I'm just gonna go see my doctor because she'll tell me what's going on.
I got you covered, girl.
So we have a ton of questions actually from some of our challengers, but I actually have some questions before that, just about some overall things that I think a lot of us can relate to, whether working in a business setting or if you're on your feet all day versus at a desk all day. Like, kind of, what are some things that'll help? Like for me, I know I sit at a desk sometimes every day, and then other days I'm like zoom, 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 zoom. So here's some questions. The first one is, what are some great exercises to do in an office where you sit most of the day? One of the girls talked about like her wrist hurting a lot from like
Mhm.
typing or like writing. So yeah, some great examples or some tips.
Yeah, so there's so many different ways that you can move around your desk. I'll give you guys just a couple of examples. Of course, if anything I tell you causes any pain or discomfort, please stop and ask your doctor about it. But these are things that should be super gentle and just natural movements at our desk. The hard part about sitting at a desk all day is that we actually just don't move at all. You get stuck in your workflow, you're answering emails, and before you realize, you've been in the exact same position for 3 hours. And it's more than anything is the not moving for such a long time that causes us a lot of pain. So I'll give you a couple examples, but any type of movement you can do to get out of your desk, whether it's standing up to get water, going to the bathroom, standing up to wave at your coworkers, are all really good ways. Um, let's just start with like a good spinal movement or something, because I know that we all get really tired at our desks, like our backs feel like they're super tight all the time. What I like to do is if I'm stuck in a chair and I can't get up for some reason, I will put my hands behind my head, give myself a little arch back to the ceiling, and a little curl down towards the floor, back and forth a couple of times. Or you can do the same thing from the side. The side this way, the side that way, and double points if you make it into a dance while you do it.
All right, I was like, I feel like I'm like,
I know you can just dance, put on some music, have a party with your coworkers. Wrists are another good thing that always need a lot of work. If you're feeling a lot of pain along this part of your wrist because you've been typing or like working at the mouse a lot, just some really good standard stretches that you might have seen in high school PE are just a really good way to loosen it up. And you can hold this somewhere between 10 and 30 seconds. Repeat it as often as you need, but you should feel a good stretch through the muscles. None of this should feel like sharp or painful. And if it is, maybe you're pulling a little bit too hard.
I
So
also
there's some good ones.
I always tell people too, like, it's it's really interesting when you like start to make it a habit. So
Mhm.
I wanted to make sure that I got up a little bit more because of my knees. I would put an alarm on my phone.
Yeah, that's what I love to tell everyone. Set an alarm because we're not gonna realize because we're busy people. We have things to do. We're not gonna think about moving if we're thinking about the thing that's exploding on our computer.
Yeah, my friend puts a 15-minute like invite on her calendar. So like
I
nobody's
love that actually.
at that time, and she's like, I'm gonna go take a walk. I'm like,
That's great. And even if every 15 minutes, every half hour is just not feasible for you, it's something that you don't need to do all at once right away. Like don't have to go from not moving all day to getting up every half hour. It's a training, it's a habit, it's a way to slowly get yourself back into a way where you actually work differently throughout the day than you did before. So just like this challenge that you guys are doing, where it takes a month of practice and dedication, it's the same kind of thing in retraining how you work and you move all day long.
No, exactly, exactly. And that is still something like when you're stuck at your desk and you're thinking, like, right, you're thinking all here, your like body's like, hey, what about me?
Oh my gosh, I do this all the time. I will get stuck in a bunch of work emails, not move for an hour, and then I'm like, shoot, I hurt my neck. I'm a physical therapist. I should know better, but I don't know better because I'm human too. We happens.
That is true. Um, and so one of those things, so I guess it kind of relates when you're sitting at a desk, and I am so bad at this, but posture. So
Ah.
about like, oh, my posture is like a really great benefit to health and like how it
Mhm.
aligns and regulates all these things. And I'm like, how do I remember to keep straight all the time? Because I am the worst. Like I have no, I have to remember to pull myself up.
Mhm. Well, I have good news for you because the overemphasis on posture is actually a myth that physical therapists are putting out research right now to say that straight, rigid, quote, perfect posture all day is not beneficial to your health and not necessarily something that's going to fix your pain. For example, being stiff and rigid in what's neutral posture might temporarily for 5-10 minutes be something that might unload your bones and joints. It could be a good neutral ergonomic that could be a good setup for you in general to return to. But staying stiff here, just like staying stiff here or here, are just as painful. It's really just like we talked before, it's the not moving part that causes our muscles to tense so quickly. And that's what causes us a lot of pain. Imagine, for example, if I were to grip my fist to hold a heavy bag of groceries, I could totally do that for 5-10 minutes if I was walking home. But if you asked me to do that for an entire 8 hours of a workday, when I went to let go of my fist and actually use my fingers, I probably wouldn't be able to. It would be really stiff and painful. That's going to be true if I stay here the whole time or if I stay crunched here over the computer the whole time. So just like you set those reminders to move every half an hour, you need to set reminders to change your posture, whether it's moving the chair, going to a standing desk, deciding to take the call while standing up or moving around. It's movement that our bodies need that are used to. Does that make sense?
Yeah, no, totally. Sorry, I have sirens going on back there.
No, it's okay. And like it helps too because the being perfect posture is just not attainable. And there is something to be said about learning how to have a good neutral posture. It can be important, especially if you have an injury that's causing you pain when your neck happens to be forward or your shoulders or your hips have to be forward. But there are ways to alter that to individualize what you need. So there's not one thing that's perfect for everyone.
Right. No, and that
Mhm.
makes so much sense. I mean, people talk all the time about like, oh, I have this pain, so I'm gonna stop moving. And I'm like, man, that's like the opposite of what my doctor is always telling me. Like, you have to be
Mhm.
moving through it because staying still is gonna be like the worst thing for your body. So
Yeah. And that's the hard thing because when we're in pain, our brains don't tell us what's good movement and what's bad movement. And so it's okay and better to reach out for help from someone who can look at you objectively and say, these are some things that we'll try that could be helpful to you. And these are some things that we'll avoid for now, but we're going to help you learn to get back to eventually.
that's so true. Okay, so so that's funny that you said like there's a lot of things about postures that physical therapists are breaking. Can you name like other stigmas that like um,
Mm.
around physical therapy in general? Like I always when I talk about physical therapy, people are like, oh, like yeah, I know my doctor told me to go, but I haven't gone. And I'm always like, why? Oh, I feel like it's gonna hurt, or like I don't
Hmm.
know, like it's a lot of commitment. They want me to go
Yeah.
like once a week. So like, what are some stigmas that you can kind of maybe?
I hear that all the time. Obviously, I'm in the profession. People tell it to me all the time, even when they get here. First, I want to talk about the it's going to hurt concept because the point of physical therapy is not to hurt, but because you're coming to a physical therapist with a pain, the whole point of it is to break down the things that are causing that pain to learn how to rework your body, your movement, your perception around them to accommodate or change or eventually recover from that. And so it's not, and it shouldn't be that the act of doing physical therapy is causing you more pain. It might cause your muscles to be sore because you're learning new things. It might be that you feel that pain because you tried something new you haven't tried in a long time and your body's just getting used to it. But a good physical therapist should be your coach through all that, should be helping to help you teach your own body what are your limits today versus what are your limits tomorrow. And even better than what are your limits, what are the things you can achieve every single time. And that's the other thing about commitment with physical therapy. A lot of people think that they come to me and I'm supposed to heal them. And I have to say, I'm a great doctor and all, but I can't heal you. I teach you and teach your body how to help itself, how to help yourself. It should be a very active process. So when you come to physical therapy, I don't just lay my hands on you, do a couple manual things, show you an exercise and say, you're done now. It's more of a way where, even though I'm involved a lot at first, I'm teaching you the independence that this injury or whatever happens to be, the pain perception will heal over time. And eventually, if you happen to feel it again, you'll have the tools within yourself to address it so that you can self-manage. And that's really, really important. And I know that not all physical therapists do that, just like not all doctors are great doctors, not all lawyers are great lawyers, but you need to find yourself a physical therapist who is your coach, who will work with you. If you say, this actually causes me the same pain, they'll give you a different exercise. If you say, I don't know how to do this at home because my life is too busy for this one thing, they'll help change it so that it fits into your life. Because it's really supposed to be about you and not about me, you know?
Right. And funny enough, I always say too that like people who like will go to physical therapy like, oh, it didn't work for me. I'm like, well, you have to do your home exercises because I know for me,
Mhm.
when I was first doing it, I wasn't doing my home exercises, and I was like, this is just doesn't. I mean, and this was like before I saw you. This was like when I first tore my ACL when I was like 20 years old, and I was just like, yeah, like this is not working. But then I realized, as long as you've had the pain, you need more time to work on it. And as from a patient perspective, I noticed that there's certain stretches that I do before a dance class, and it has helped
Mhm.
tremendously. Like
Good.
knowing that I do like spend 15 minutes to stretch out my legs and my hips has
Mm-hmm.
major difference in how I feel after a dance class. Like if I
Mm-hmm.
do it, I am so sore. I can't walk for 2 days. And that's, a lot of my arthritis, but knowing that
Yeah.
stretching is super important and like those home exercises. And then I come home and then I ice them down. Like I wake up and I'm like, oh, it's like I didn't even have a dance class. Like I feel so great. And that was never the case. And I know the
That's great.
I know the
Physical therapy is not supposed to be something you do. It's supposed to be something you learn to change your life so that you don't have to have the dysfunctions that were keeping you down beforehand. And that's really important. And it's true, at first it's hard. It's a commitment. It's a lot of work to do because you're learning something new. But over time, as it does become more of a natural part of your life, it's more maintenance. It's more you taking care of yourself in a way that you didn't have to back when you were hurt. Now that you're more on top of it, eventually it's these are the things that will help me so that I don't have to necessarily go back to that same pattern again.
totally. And there's also some things like when people say that you have to really get a second opinion too, because like seeing a doctor for one thing and then seeing a doctor for like physical therapy are two different things. So like I know when
Mhm.
I found out I had arthritis, like Rachelle remembers I was like crying because the doctor was like, well, you shouldn't jump anymore, you shouldn't squat, you shouldn't do CrossFit, you shouldn't do any of these things. That's gonna irritate your knee. And I was like, I can't dance again, I can't do anything again. What am I gonna do? And Rachelle's like, come here, my child. Let's figure
There's a
out
lot of hugs involved in my therapy for people who like hugs.
let's figure out what your body can do and how we can prepare you for
Yeah.
doing things just modified. And I was like,
Yeah, and our bodies are always evolving. So I, as a doctor of physical therapy, know how to help you with your movement. Your doctor of orthopedist knows what was happening inside of your knee joint, which helps inform me. but together we work together. So even though at the time when it was most flared, something like jumping, CrossFit, really heavy lifting would definitely irritate it, it's not necessarily, Jesse, you can never ever do that again. It's, Jesse, we're going to have to teach you how to modify for now and eventually get better so that if you want to do those things again, we're doing it in a way that won't hurt you again. And that's going to be different than someone who doesn't necessarily have the knee arthritis that you might have, and that's why it's very important to get help from someone who can individualize their program to you.
No, that's so true. Um,
Hmm.
because I know that even now, like letting, and then also let your trainers let people know, like when you have an injury, sometimes we get embarrassed as people, like I have bad knees and I'm gonna still do this anyway because everyone else is doing it, and like I'm the first one to be like, is there a modified version for this? Because you can do that.
Yeah. You have to take care of yourself. That's the most important person. And in that moment, your health is going to be more important than the opinions of those around you.
Exactly. Okay, so this one's a hot topic, and I feel like um, to the challenge in particular, this is really interesting. Um, and so I've heard the statement before, right, where doctors tell me to lose weight and then I won't feel pain. So um, let's say the example of like arthritis in your knees, or I have bad knees, and doctors tell me if I lose weight, I'll put less pressure. But I
Mhm.
also know skinny people who have arthritis. So
Mhm.
what is weight management the only way to deal with pain? And if
Mhm.
losing weight is hard, like let's say you have a thyroid issue, or just like it's been a struggle, or it's been something that's more than just physical, what are some other ways to deal with pain management?
Yeah, so that's only part of the story. And just like you said, weight loss, weight gain, weight management isn't necessarily the only thing that's going to help you manage your pain. Even with something like arthritis that may or may not be directly affected by changes in force in your body, pain is very multidimensional. And pain is actually a construct of our brains. And that does not mean that your pain is not real. Everyone's pain that they experience within themselves is a real pain. But that doesn't mean you can point at exactly one factor and say, that's the reason for my pain. So, pain is a bunch of things because it's your brain's interpretation. It can be affected by a lot of triggers. Bones and joints, muscles, orthopedics, that's what I deal with as a physical therapist. So that's what I'm trained to help you with. That's only one piece of the puzzle. Another piece of the puzzle could be nutrition, which is not just weight loss. It's the things that you're eating, the water of your body, the things that make you feel good or feel bad or might hurt your thyroid or hurt your stomach. Those change the chemicals in your brain and have you maybe experience more or less pain. That's true for emotional well-being and wellness as well, psychological wellness. That's true when it comes to sleep. It's true when it comes to perception or fear of your own pain. There are so many things that affect our mind, and then our mind processes them all very quickly without us realizing, and that outputs to I'm feeling pain somewhere. So if you go to one doctor, they might tell you something very different about what's causing your pain than another doctor, because each of those doctors are only a very small piece of the puzzle. So as you're addressing your pain, even if you're with someone like me, like a physical therapist, I'm not the only thing that's affecting in your life. Your knee arthritis or your finger arthritis or the pain in your foot isn't the only input that makes your brain say, I have pain. So you really need to address all of those things. For one person, it might be weight loss. For one person, it might be changing their diet to include less breads or more uh, vitamins or more water if you find that you're dehydrated. If you're not sleeping at night, and that will cause our brains to feel like they are in danger because you're not feeling well, and they're very heightened to the sense of pain. So this isn't something that is taught enough, I feel, especially as we're going through health classes growing up. We can't just think of ourselves as separate entities, physical, mental, uh, eating, not eating. We have to think of ourselves as one person and treat ourselves very well in all of those aspects.
And that's really kind of what the 21-day challenge too is about, is because
I love that.
yeah, it's not a lot of people came in and were like, oh, we're gonna learn how to love our bodies, cool affirmations, but like a lot of what I put into this challenge is about understanding our bodies, being,
Mhm.
you being a great example of like talking about pain management and what our bodies are, can and can't do, or what we're capable of, because it's so important.
Mhm.
Self
Yeah,
love.
and just having that awareness is such a good start. I have a really great 5-minute video I like to share with my patients that just clearly explains all these weird concepts I just brought up. I'm going to give it to you because I think it'd be really useful. Our national association advertised this video, the American Physical Therapy Association. I think it's really cool.
Yeah, we'll definitely share that out too, because self-love and self-care, I feel like, go hand in hand. And
Hmm.
I think about that all the time. To say I love my body so much that I'm going to take care of it is such um a huge feat in itself, but also a great realization of like, this is what body positivity means to me. It's not just saying I accept myself for who I am, but also I love myself so much that I'm like, I matter to me, like
Hmm.
the most, and that means that I need to care for myself and not put my energy and everything to other people. I can still do that, but still make sure that I save some of that energy and some of that love and some of that care and TLC for
Hmm.
myself. So
It's so important.
so important. Um, so lastly, some of the girls had some questions about certain things, and I know this is probably going to be more like, "Hey, see your doctor." But some of the girls had some questions about pain relief, about I hope I'm saying this right, plantar fasciitis. Am I saying that right?
Yeah, I've actually heard it a few different ways. I say fasciitis.
Okay. Back spasms,
Hmm.
ulnar pain, and then bad knees, which we talked about bad knees a little bit. But these are some of the things that our girls are like going through, and some girls have talked about their PCOS, and how that affects their bodies.
Hmm.
Any
Yeah. With all of these things, because we just talked about how your movement and your pain perception are just so multifactorial, it's really, really important to realize that these are not things that you have to live through or push through in your life. These are things that experts, doctors, coaches can help you learn more about your body so you know what helps you feel better or what helps you to not feel better, or things that you can do to slowly over time build up more of the function that helps you get back to the things you need to do in life. So when you have those pains, a lot of us are told from a young age, just work through it, you'll be okay. You don't have to do that. Physical therapy, going to the doctor isn't just for the extreme injuries, like I fell off of something and hurt my foot. If you have plantar fasciitis, if you have ulnar pain, you've had it for a long time and it's not going away, some habit in your life, some way of moving, some perception of your pain is causing that to perpetuate. And it's important to get an opinion of someone who can help you learn what are the triggers of this so you know how to come out of it. So I will tell you, you have to go see your doctor for those things. I think it's very important. And I think it's important that you get the help sooner rather than later so that you don't have to avoid things in your life that are important to you because of it.
That is so true. And speaking of doctors, you guys are in NYC, and I think some of you are in this challenge. Spear Physical Therapy has multiple locations in New York. I happen to go to the one downtown, but there are many locations, and I cannot tell you how amazing I love them as a company. I think they're awesome.
Thank you.
Just the people there too, but the company itself is very kind and very all like really about the patient and what they can do for you. So I will
Thank
also
you.
link Spear Physical Therapy in this as well. Rachelle, any last words?
I just want to say that you guys are doing a really important thing for yourselves right now. So I wanted to commend you that you are taking time for yourself, and not everyone realizes how important that is. So good job. Take that time for yourself to make yourself better for you so that then you can affect the world in the way that makes you happy. So good job, guys. Keep going.
Thank you, Rochelle. Thanks, guys, and we'll be talking about more fun stuff later on in this challenge. Have a great day, guys.
Bye, y'all.